Thrive in Motherhood Program Plan, Part B. Thrive in Motherhood's goal to reduce the low birth weight rate and infant mortality rate in Colorado Springs, Colorado, will be accomplished through utilization of the CDC Synergy Model, the Generalized Models Implementation Plan, stakeholder support, the utilization of the Trans-Theoretical, Information Processing Theory, and Behavior Belief Model, timeline, and budget. Through implementation, a timetable will help with resource management and accountability. The timetable will be based on objectives and evaluation requirements within a 2-year period. To ensure that funding will be utilized effectively and efficiently to achieve campaign objectives, a budget will be adhered to. Thrive in Motherhood has been sponsored with $50,000 by the state of Colorado to improve maternal health based on the low birth weight rate goal of Healthy People 2020. This will be used to improve the wellness of maternal women through community endeavors and thereby achieve Thrive in Motherhood's campaign objectives. Barriers and problems of implementation. Problems which may impede Thrive in Motherhood to meet goals include lack of stakeholder commitment and involvement, lack of interest amongst maternal women to improve their wellness choices, and loss of state financial support through El Paso County Health Department. Much of Thrive in Motherhood's success depends on the potential stakeholders, WIC, KOAA Local News, the local YMCA centers, Colorado Springs Public Libraries, the Dream Centers of Colorado Springs, Colorado, Colorado Springs Pregnancy Centers, and Pikes Peak Community College, supporting and contributing to the Thrive in Motherhood initiative. Although these stakeholders' missions best align with the Thrive in Motherhood goals and objectives, there are many other organizations within the community of Colorado Springs who may be of assistance if these first-choice stakeholders do not rise to the Thrive in Motherhood aspirations for improving the community. It is often difficult for individuals to make lifestyle changes due to their lack of awareness of personal risk. This may be true for many women in the Thrive in Motherhood target population. Finally, although Thrive in Motherhood has been promised a 2-year health education opportunity to improve the wellness of maternal women and their developing children throughout Colorado Springs, the El Paso County Health Department may choose to direct funds elsewhere if other needs are deemed more pressing. Solutions to barriers. These potential barriers will be met with strategic planning, flexibility, and innovation. To confront the barrier of lack of interest amongst maternal target population, process evaluations will be used to identify the communication campaign effectiveness or lack thereof, and through these evaluations, modifications will be made to improve upon the communication campaign to more effectively generate interest. To help prevent the barrier of loss of financial support, regular reports will be submitted to stakeholders to encourage support. These reports will describe the evaluation results of the program every 2 months. The progress and challenges faced by Thrive in Motherhood will thereby be communicated, helping maintain interest. To help prevent the barrier of lack of stakeholder involvement, stakeholders will be included in evaluations, and their contributions will be recognized with appreciation when Thrive in Motherhood objectives are met. Also, if some stakeholders Thrive in Motherhood is planning to recruit do not wish to be involved at the level Thrive in Motherhood requires for optimal implementation, other stakeholders within the Colorado Springs area may be recruited instead. Evaluation method. To ensure the greatest potential is being met at all times by Thrive in Motherhood, Evaluations would be conducted at each phase of the program. Formative evaluations will be conducted at the outset of Thrive in Motherhood. Data will be gathered about the current state of maternal women within the target population in Colorado Springs, and pre-test groups will be organized to analyze curriculum and message effectiveness before implementing the program to the public. Process evaluations will be conducted every 2 months to determine the behavioral progress of the women participating in Thrive in Motherhood, and stakeholder organizational evaluations will be conducted biannually to determine if modifications need to be made to improve effectiveness and efficiency within the program. The summative evaluation will again gather similar data as the data gathered at the formative evaluation and compare the statistics. This will help indicate the degree of effectiveness Thrive in Motherhood accomplished within the implementation. Evaluation method continued. To maintain funding, the Thrive in Motherhood Health Education Specialists will diligently conduct evaluations at the formation, throughout the process, and at the summation of the Thrive in Motherhood program, and submit the results of these evaluations to the El Paso County Health Department with plans for improving or following action to maintain accountability and interest. Thrive in Motherhood will use an experimental evaluation design. The most control over data may be observed through experimental evaluation designs. WIC, the Dream Centers of Colorado Springs Pregnancy Centers, and Pikes Peak Community College will also be requested to help with the completion of quantitative and qualitative formative research, set up pre-test groups, experimental groups, and request volunteers for a control group amongst maternal women who do not wish to participate in the Thrive in Motherhood initiative. Through face-to-face interviews, this qualitative data will be collected. Experimental groups and control groups will help establish the basis for evaluating many of the objectives proposed in Thrive in Motherhood, as it will be utilized to evaluate diet, physical activity levels, tobacco and alcohol use, and consistency of prenatal appointment attendance. Comparison evaluation will be used to determine success for Thrive in Motherhood in decreasing rates of infant mortality, low birth weight rates, and preventable pregnancy complications throughout the Colorado Springs area by comparing the formative data rates with the summative data rates. These evaluation design methods will be executed with care to maintain internal and external validity of results. For the most effective stakeholder engagement and evaluation reporting, stakeholders should be involved as much as possible in the evaluation process, including designing the evaluation, collecting the data, and analyzing the results. Guided by the goal and objectives of Thrive in Motherhood, this level of involvement will encourage the initiative of the stakeholders. Campaign outcomes. It is the aim of Thrive in Motherhood that the campaign outcomes help the target population of maternal women in Colorado Springs to have healthier lifestyles throughout their pregnancies. Consumption of nutritious diets, moderate physical activity, avoidance of harmful substances, regular maternal medical visits, and the involvement of mothers-to-be in educational courses to build a future for them and their new child are the main behavior changes which this campaign hopes for its outcome. Through the resources provided to women involved in Thrive in Motherhood and close monitoring of the method effectiveness of Thrive in Motherhood, within 2 years the maternal health of women in Colorado Springs may be improved upon, thereby reducing the low birth weight rate and infant mortality rate in Colorado Springs, Colorado. Future application for Thrive in Motherhood. The completion of the 2-year Thrive in Motherhood campaign is not, however, the end of Thrive in Motherhood's effect. The results of Thrive in Motherhood's 2-year program will be published in scholarly journals and circulated amongst other interested health education specialists to benefit the health education community's understanding of such initiatives and their effectiveness. If Thrive in Motherhood proves to be effective, highly beneficial program for maternal women, its funding may be extended and the program continued for future generations of mothers. If Thrive in Motherhood achieves what it sets out to accomplish, other communities also struggling with maternal health may utilize this program as a model and implement similar improvements within their communities. Influencing mothers to choose healthy lifestyle behaviors influences the next generation, as young children are less likely to be allowed unhealthy behavior development. Through helping maternal women, we improve the next generation's potential for healthy, fulfilled lifestyles.